Assalamualaikum and very good morning to my respected lecturer, Prof. Zainal. Before going into the details of my topic today, I would like to introduce myself. My name is IZZATU'ADLINA and I will talk about female reproductive system. So, for introduction of female reproductive system, it plays a crucial role in processes such as the production of egg, fertilization, pregnancy, and childbirth. This system not only facilitates the creation of new life, but also regulates key hormonal function essential for the menstrual cycle and secondary sexual characteristics. These organs work in harmony under the regulation of specific hormones to enable reproductive function. Additionally, female reproductive system undergoes significant changes during different life stages such as puberty, pregnancy, and menopause, highlighting its dynamic and vital nature. As for the anatomy of female reproductive system consists of vagina, cervix, uterus, fallopian tube, or also known as uterine tube, and ovary. So, firstly, vagina is for sexual intercourse, where it receives sperm, while cervix connects uterus and vagina. Cervix has lots of properties. One of it is cervix can become white during birth of baby. Then uterus will receive fertilized egg and be the site of implantation, specifically on endometrium along the anterior or posterior wall of body uterus near the fundus. Then fallopian tube is first passageway where secondary oocyte and sperm meet and form fertilized egg. And lastly, ovary is site for producing secondary oocyte. Then we move to physiology. First physiological events that occur in female reproductive system is fertilization, where sperm enters the fallopian tube and fuse with secondary oocyte and forming zygote. First thing first, as we know that ovary produce secondary oocyte and release it to the fallopian tube. But when sperm is released into vagina, there are few barriers that before it can achieve uterine tubes. First barriers is vaginal pH. Not every sperm is able to survive inside the vagina due to its acidic environment. Also, when sperm enter the female reproductive tract, white blood cells is unable to identify the sperm cell, so it will be considered as foreign cell. In response of immune system, they will be destroyed by phagocytic uterine leukocyte. Next, cervical mucus. Secretion from the cervix and vaginal discharge vary in consistency and texture throughout the menstrual cycle. During ovulation, cervical fluid is more thinner and less denser to facilitate the passage of sperm. Conversely, when the woman is not ovulating, this fluid becomes denser and viscous, which complicates the sperm journey. So, this barrier will cause the reduced amount of sperm that can make it to the end, which is enter the fallopian tube. Next physiological event is implantation. The fertilized egg will be implanted on endometrium along the anterior and posterior wall of body uterus near to fundus. There are few signs that will show a woman if implantation has occurred, such as bleeding and cramps. This bleeding can be confusing sometimes because it may happen around your period time. Most commonly, it will occur a few days or weeks before your expected menstrual period. There are few differences that can help you determine whether you are experiencing implantation bleeding or period. Firstly, implantation bleeding is most likely to be light pink or brown, and it is opposed to the bright or dark red of your period. Then, implantation bleeding is more like spotting than an actual flow of blood. This spotting may occur once, last for a few hours or up to 3 days. You may notice some pink or brown discharge when you wipe it, but you don't need a full pad or tampon. As for cramp, early pregnancy causes a rapid shift of hormones. Most specifically, implantation triggers the hormone surge. That's why you can't get second pink line on a home pregnancy test until after implantation. And the changing hormonal tide can also cause cramping. One of the biochemistry processes that occur in female reproductive system is menstrual cycle. To begin, the menstrual cycle is a natural monthly process in the female reproductive system. It prepares the body for potential pregnancy, and if pregnancy does not occur, the uterus will shed its lining, resulting in what we commonly know as period. Menstrual cycle is divided into 4 phases, which is menstrual phases, follicular phases, ovulation phases, and luteal phase. During the day 1 until day 5 of menstrual cycle, uterine lining that has thickened to support pregnancy will shed through the vagina as blood and tissue. This will only occur if no fertilization. Then, this process is called menstruation or a period, where hormone levels of estrogen and progesterone are low, which causes symptoms like cramp, fatigue, and mood changes. So, for the second phase is follicular phase, where the pituitary gland will release follicle-stimulating hormone, FSH, that will stimulate the ovary to produce several follicles. Each follicle will contain an immature egg, but only one dominant follicle will mature. The hormone estrogens will increase during this phase. It will help to thicken the uterine lining to prepare for a potential pregnancy. Next, ovulation phase that occurs around day 14. A surge in luteinizing hormone LH causes the release of mature egg from the ovary. The eggs will travel into the fallopian tube and can survive up to 12 and until 24 hours. This will be the most fertile phase of the cycle, as the egg can be fertilized by sperm. And lastly, luteal phase, which lasts for day 15 until day 28. In this phase, after ovulation, the empty follicle will form the corpus luteum, which produces progesterone and some estrogen. This hormone helps maintain the uterine lining in case of secondary oocyte got fertilized. If fertilization does not occur, the corpus luteum will break down and hormone levels drop, causing the uterine lining to shed, leading back to the menstrual phase. The disease that can happen in female reproductive system is first placenta previa. Placenta previa is a condition during pregnancy when placenta is completely or partially covers the opening of uterus. This will be treated by C-section delivery. Next disease is ectopic pregnancy. Ectopic pregnancy is when a fertilized egg is implanted outside of the normal implantation site, and this can be treated by methotrexate. Lastly, for specialists in obstetric and gynecology, I choose Dr. Jennifer Gunter as I aspire to become an obstetrician and gynecologist who not only provide quality medical care to women, but also plays an active role in educating the community, especially women, about reproductive health, maternal wellness, and overall women health care. I believe that raising awareness and empowering individuals with knowledge is key to improving health outcomes in a society and fostering a healthier society. Back to Dr. Jennifer Gunter, she is author of influential books known as the Menopause Manifesto. These books give guides to understand menopause better and combating social stigma around aging. Then, she also advocates for evidence-based medicine, where she frequently debunks medical myths made by celebrities or influencers. Lastly, she also works on reproductive rights for women's health. For example, actively address topic about abortion rights.